Hi everyone, welcome back to my channel. I'm glad you are there. Today I'm going to talk about bronchial asthma. I have been working a lot for this and I'm very excited to share with you. There are some key points I would like to discuss about bronchial asthma. Clinical features, signs, common triggers, and use of inhaler. So grab your relevant items like coffee, notebooks, and let's dive in. And don't forget to subscribe to this channel. So let's start. Clinical features. What we see: wheeze, breathlessness, chest tightness, cough, and sign. We hear the wheeze like sounds coming from the lungs, and family history will be positive, and as like family history positive in case of asthma, atrophy, allergic rhinitis, and hay fever, allergens, air, exercise, aspirin, beta blockers. These are the some common like triggerings. Let's talk about the triggering factors. There are some triggering factors we see: tobacco smoking, dust mites, air pollution, cockroaches, pet farts or animal farts, mold, cleaning supplements or dust-like things, flu or respiratory infection. These are the common triggers of the asthma. This is the most important thing. We need to know who has asthma. Most of the time we see patients are using wrongly and they makes mistake during using inhaler. So what are the steps how you can use properly inhaler? So first step, remove the cap and shake the inhaler first. This is the first step, and then breathe out gently. Third step is breathe in and press the trigger if needed. Shake it and press the trigger needed. Hold your breath for a count of 10, then slowly breathe out. This is the proper way to use inhaler. Whatever you are using, if you are using salbutamol or any other steroid containing inhaler, you can use according to your prescribed doctors, according to prescription. So this is all about this video. Subscribe to the channel and thanks for watching. Until next time, see you in the next one. You can follow me on Facebook, link in the description. So goodbye.